All right, so we're going to be covering the shoulder capsule. Capsule is really important for overall mobility, stability in the shoulder. And a lot of times injuries start with the capsule because the capsule is really deep, and capsules they're really like ligaments that are bound up, and capsules don't get very good blood flow and oxygen. So when they get beat up and they get scar tissue, they can really limit that. Now, the thing is, like, actually finding the capsule and finding where it's at. A lot of times it actually lives right where the humerus comes in and attaches on the scapula, and it lives right between the posterior delt and the tricep. And usually what I find is that practitioners are either on the delt or they're on the tricep, and it hurts like hell and they're not getting an effective way. So the way I like to treat this is I have the client side lying down like that. And the first thing that we want to do is we're going to open up this arm to palpate. And I'll let them just kind of hang it out there on the table just like that. And I'm going to start to go in here and start to find some landmarks. And the first thing I want to find is the humerus, where I'll separate it out. So here comes the delt, here comes the tricep, the humerus is in the middle, and then I'm having that landmark as I go up. I'm going to keep going, so I'm like humerus, tricep, I don't want to be on the delt or there, and I'm going to keep going until I get right up until that articulation here, and right there is where the capsule is. And it's actually really deep, and you can sink in. If I'm too far that way, I can't sink in as much because I'm on the delt or I'm on the tricep. So the first step in the first battle is finding it, because if you can't find it, you can't fix it. So what I like to do here is now my thumb is right there, and sometimes if you have trouble finding it, you can play around with the different levels of that, and it will open up and that'll pop up. So right there, I'm feeling it for her. And normally I like to have the client do the motion themselves, but when it's the first time and it's a bad capsule, I do have to treat it with the motion myself. So my first thing is, and coming real close on this one. So I'm here and I get my depth straight in. Now, normally with a muscle, we get depth and we have to back out a little bit, 10 or 15%. Capsule, I don't, it's full depth the whole time. So now I'm here and I get my depth by leaning in with my body, and then I get some tension by leaning in some more. And then my motion is going to be to continue to keep that depth and tension, and I'm going to bring this arm back. And I want to bring the arm back first. Ooh. And then that shoulder dropped on its own. And then I'm going to drop it in like that, and then I'm going to finish it off with a nice lean. Now, that one's hard on you because your thumb is really out in an exposed area. But sometimes you do got to do that for the first one. But eventually, I like that client to be able to do the motion themselves. So I will coach them through that. I'll say, Shauna, you're going to start here, and then you're going to bring it back nice and slow, and then I'll start to drop it. The beauty of being able to do this is I can actually get in there with two hands, and I can get way more force, and it's less on my body. So now I'll be here. And what I like to do is I like to use my inferior arm and then back it up like that. And sometimes you got to grab on the armpit, that's totally fine. In through here, and then I'm going to bring her up to start, and then I'm going to get my depth by leaning in with my body. See how much I can sink in here, but I'm not going to come out. And then I'm going to get some tension with my body lean, and then Shauna's going to start to move her arm back, and then I can use my hands to help kind of fulcrum that a little bit and open that up. And you can see I'm shaking, I'm working pretty hard here. And then she's gonna drop that down towards her ear, and then I'm gonna finish that off with a lean. And usually on the capsule, I'll hold it for about 10 seconds or so at the end, and I'll do about 3 to 5 passes on this one. So that's the video for the capsule.